Good afternoon, and welcome to today's webinar titled Fill the Gap in Patient Narrative to Improve Financial Outcomes. My name is Jeanette Wider, and I'm Managing Editor of Healthcare Innovation. Today's program is sponsored by Nuance. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, we have a few housekeeping details. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh, and if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, I'd like to introduce our speakers for today's program. We have Dr. Jared Pello, who is the Chief Clinical Product Officer at Nuance, and Brianna Wong, Principal Product Strategy Manager at Nuance. I'll let you two take it from here.
Awesome. Thank you so much, Jeanette. Thank you, everybody, for making time to be here today. I'm excited to share some challenges of healthcare and some solutions of healthcare and how I think that we can continue to move forward towards progress, towards better patient care and better financial outcomes. So let's go ahead and just jump right in. So first off, I want to be cognizant of what we're facing as an industry, is what we're facing as institutions. We know that operational efficiency is one of those things that we're always striving for, but it's very difficult as we find our physicians spending more and more time and burdened with more and more documentation burdens. We also know that many of our physicians are not the best at keeping records. And because of that, we lose out on reimbursement and we don't have the correct records in our EHR. And all of this adds up to not only them feeling overburdened and sometimes not completing their work, but feeling dissatisfied in their work. And 42% of physicians are burned out today. And I went through this myself as a young physician. I'm an emergency medicine physician, was practicing in Lynchburg, Virginia. And one day grabbed one of my partners and asked him about how he stayed so happy. He was the happiest physician in our group. And what he told me kind of shook me because he said, Jared, every day I'm not at work, I dread coming back to work. But what he did tell me was that physicians who seemed happiest were those physicians who were either in administration or who were working to make healthcare better, who were innovating. And what I see is a growing population of physicians unsatisfied with their work and wanting to make healthcare better, but not always feeling like they can. And 64% say that burnout has intensified due to the pandemic. And we know that there's real financial costs to the health system as a whole, and even down to healthcare institutions. And there is a large shortage of physicians today, and that shortage will continue to grow. And we also know that there's a suboptimal provider-patient experience. We've all felt this when we go to see our physician, and our physician either has a computer in front of them or they're turning to the side to look at a computer and then turning back to look at us. I think we could all agree that what we want is a physician who's engaged, who's watching our nonverbal cues along with our verbal cues, and is taking time to listen. And we know that 61% of patients would visit their healthcare provider if they felt like communication was better, if they felt like they were more personalized and more in touch with their physician. Now, physicians, they went into medicine really with a calling. If you talk to physicians and you ask, why did you go into medicine? Most of them don't say for the paycheck. Most of them say, I felt called to it. I loved science, or I loved taking care of people, or my mom had cancer and I felt like I wanted to do this. And physicians are willing to sacrifice to have a better work-life balance. They're willing to sacrifice. They feel the burnout. They're willing to sacrifice. And nearly half of physicians said that they would take pay cuts to have a better work-life balance. And so you can really start to understand that for physicians, this is painful. It's painful to the point that they're willing to pay to make it better. And we know that as an institution, it's painful whenever we lose a physician. And we're seeing greater and greater physician churn, meaning we're having more and more physicians come and go within institutions. We're having more physicians than ever leave practice medicine, which to me is heartbreaking because I know what it takes to become a physician, and I know how much physicians take pride in what they do. And for each provider who leaves your institution, it's likely a $500,000 to $1 million bottom line hit, meaning the cost it takes to recruit and retain a new provider along with the lost revenue while that provider is out adds up. And what we've done in this slide, you can see, is we calculated what is that cost per provider per year if you have an 8% attrition rate, if 8% of your providers leave each year. And some institutions will find that this rate is higher. Some will find that it's lower. But when we get a little bit further in the presentation, Brianna's going to talk about how we believe we can help you decrease this no matter where you're at in your attrition rate. So you might be asking, okay, what is it that Jared thinks he can provide that can make these things better for us? And I think there's a new approach to today's challenges. There's a new way to tackle these issues. And it's really returning physicians to what they want to do. It's returning physicians to the care of patients and away from the burden of documentation. And we have a tool called Dragon Ambient Experience. It's an AI tool. It's ambient conversational listening, meaning that we record the natural conversation between a doctor and a patient, and then we complete that clinical note. And to us, this also is a mission. It's a calling. We feel like this is something we have to provide to the world because we have the right people on the team, we have the right data, the right knowledge to make this happen. So to give you a little bit of an idea of what we believe we're accomplishing and where we're going, we have a short video to show you.
You don't become a doctor to bill. You become a doctor to take care of patients. You become a doctor to serve humanity. Ambient intelligence allows for the patient and doctor to be a patient and a doctor, like it used to be.
For more than 2 decades, Nuance has pushed the boundaries of what's possible with voice and language understanding. We built the conversational AI industry. Now we're redefining it.
What was once an ambitious vision is now a reality with the Dragon Ambient Experience.
By combining our healthcare expertise and track record of proven outcomes with Microsoft's extensive AI research and enterprise-focused cloud services, we're accelerating the delivery of ambient technology and using it to power the modern exam room.
DAX puts the conversation back in the encounter, providing immediate relief from time-consuming administrative burdens by offering clinical documentation that writes itself.
By supporting a wide range of medical specialties, we're delivering on the promise of a better patient and provider experience. Our continuously evolving purpose-built ambient device does more than just securely capture the conversation. Through multiple microphones, a large interactive touch display, and integrated virtual assistant, biometric, and machine vision capabilities, it acts as a seamless extension of the electronic record.
We're thrilled to share our progress, not just as Nuance, but collectively as an industry.
Thanks to the overwhelming support and encouragement from you, the healthcare community, and from our partners,
the exam of the future has arrived.
So hopefully that gives you a general idea of our mission. And I always get a little bit of cold chills when I watch that because it reminds me of what we're setting out to do. And it's very audacious that we believe we can accomplish it. And we are accomplishing it. That's the exciting part. And what's exciting to me today is I get to speak to you really about kind of cold hard numbers. And we do different talks. We do talks where we kind of show the clinical piece of this, and we talk about the hundreds of millions of parameters within our neural net, the AI in it. And that's all really neat. But in the end, we know that healthcare is a business and that we have to deliver real world results. So this slide talks about some of those real world outcomes that we're seeing. Now, DAX has been available for about 18 months. We launched in February of 2020. So a little bit over 18 months. And we bucketed these outcomes into 4 different buckets: operational efficiencies, physician satisfaction, documentation quality, in patient experience. And I'm going to take my time going through these because I think that these are the things that we make better. And if you decide to investigate more, what could DAX do for you? These are the levers that we're going to pull on and work with you to make sure that you have the ROI that you want. So first and foremost, looking at operational efficiencies, we know that providers spend lots and lots of time on documentation, and we've been able to save providers 7 minutes per patient. So if you have a primary care provider who's seeing 20 patients a day, that's 140 minute savings that we're able to provide to that provider. And for most providers, we will tell healthcare institutions, hey, don't even worry too much about adding new patients right off the bat. Have your providers use DAX and let them experience what it's like to really just take care of their patients and not have to worry about their documentation. And what you'll find is most providers, after a month or two, they feel the weight lifted off of them and they come to you and they say, hey, I feel like I can see more patients, especially for providers who have a backlog to see their patients. They want to see those patients faster. And so that's been really fulfilling to see them adding 3 to 5 new patients per day, per clinic day. And physician satisfaction, of course, is huge. For those of you who are physicians or who work with physicians, there's hardly anything that I can think of that 93% of physicians love. Like if I were to order lunch for a bunch of physicians, I probably couldn't get it 93% right. But 93% of physicians love using DAX. 9 out of 10 say that they would recommend it. And 70% there's been a 70% reduction in the feeling of burnout, which it's a big one for me because we know that recent studies have shown that physicians experiencing burnout are twice as likely to make a medical error over the next 3 months. And so to me, this is really saving lives when we can reduce that feeling of burnout, make them more attentive, help them enjoy their job more. Now, you might wonder, okay, well, DAX is using AI. Can it really write a document as good as a physician? And 79% of physicians say, yeah, DAX actually writes notes better than I write them myself. And then real world financial outcomes, almost $19,000 of added revenue per month. And we've got a calculator, and we're going to kind of walk you through how that calculator works and how we can apply it to your situation. And we can do that outside of this experience with you personally and help you see how DAX can really drive to your bottom line in ROI. But then what's really important to me is that patient experience. And 83% of patients say that their physicians are more conversational, that they're more focused, and that they're less likely to be stuck on their computer. And that's huge to me. That's such a big number. It's almost like flipping a switch and taking that chair that the patient, where the physician was turned away from the patient, and taking that chair and facing the patient and getting them connected. So you might wonder, okay, well, Nuance has been doing this for 18 months. Are they doing this with anybody I might know? Well, here's a small list, a small sampling of the institutions that are using DAX today. And some of the really interesting ones to me are ones like Metro Health. And if you even just go to YouTube and look for Metro Health and DAX, you're going to find that Metro Health has expanded DAX to all their primary care providers. And the reason why is they've seen this great ROI, they've seen this decreased burnout, and they want to be able to recruit and retain the best primary care providers they can. And they see DAX as a real competitive advantage. The same at Cooper University. They've made big investment in DAX, believing in the ROI that they've been getting. Now, DAX cannot be used all over the hospital today. DAX works in the ambulatory space, in the urgent care space, primary care, and telehealth space. So we do not provide services and technology yet in the acute care space, but really any ambulatory location, we can help your providers with their documentation burden. So you're probably wondering, okay, Jared's talked about how awesome this is, but how does it actually work? So I'm going to just walk you through this. And if at some point you actually want to see a demo of this, we'll have some information at the end where you can see a demo. You can invite your physicians or other physicians to join you to watch that demo. But the way this works today is we capture that conversation with an iOS device and an iOS app. We've been able to optimize those microphones on the iOS device to really be able to allow us to capture audio at far field. So we can capture audio all the way across a clinic room, your back turned to the wall with a mask on, and we can still capture that audio. We can also capture that audio with our integration into Microsoft Teams. Now, once that audio is captured, it goes to our Nuance AI cloud. And the first step is what we call conversational diarization. And that's separating out the doctor speaking and then the other people in the room speaking. And after we get clean transcripts of each of the speakers, that goes into our AI-generated clinical note, and that's using natural language generation, where a computer has been trained to write like a physician. And we've done this by using millions and millions of recordings of doctors and patients talking, and millions of final documents, final clinical notes. And the computer has gotten really, really good at writing these notes. Now, good, but not perfect. And so we do send the note through a quality review check, and that's a quality documentation specialist trained up in whichever specialty is being used. So if you have a cardiologist using this, a cardiology quality documentation specialist is going to take care of that note. If you have primary care, same thing. And they get that note as close to 100% as possible. They do this by listening to the audio, by reviewing the transcript and pulling out the clinical facts and making sure even the grammar all looks right. And then they put that directly into the EHR where the provider signs off on that. And we have different service level agreements on what that turnaround time is, but it's anywhere from 4 to 24 hours, depending on the size of the institution and what you sign up for. Now, this is all using our secure mobile app or Teams, but the great thing about our secure mobile application is you can use it for any telehealth platform, any televideo telehealth platform. You can go ahead and use the mobile application on your end as the clinician. You can record yourself talking and capturing the audio from yourself speaking and your patient speaking. Now, you might wonder, okay, so I'm understanding how the technology works. I understand that it goes to this AI cloud, but how has this AI cloud been trained? How do I know that I'm going to really get the kind of documentation that can withstand an audit, that can bill and code at the appropriate levels? And we've really built our clinical documentation on standards from the industry, HDI, CMS, making sure that we have our compliance down in our specialties and making sure that we're producing the data that you need to be able to deliver the best care and also have the best financial outcomes. So in my next slide, I'm going to just allow you to look at what an AI generated draft note looks like. I know it's small. Like I said, if you want to, definitely sign up to come see a demo. It's really, really neat. They're free flow demos where you kind of get to choose what's going on with the patient. But on the far left, you see a transcript, diarized transcript, doctor and patient speech being separated out. The next pane over, you see that AI draft note. You see some blanks in there. If you were to listen to that whole audio, you would see that that draft note's not perfect, but it's pretty darn good. And if you read the HPI, the assessment and plan, you'll see that it's written just like a clinician would write those sections. And then over on the far right, you'll see that finished note. It's gone through the quality review check and it's ready to go. So the impact of all of this technology is really to get you the outcomes that you want, that reduced provider burnout, that better patient experience, and then lastly, the business of medicine drive a true ROI. So with that, I'm going to turn it over to Brianna, and she's going to tell us a little bit more about the numbers.
Thanks. So Dr. Pello went over some of the outcomes that we've been measuring, and we're going to dive into a little bit of those in more detail and also the financial impact of those outcomes. We mentioned that 7 minutes is the average amount of time saved on documentation per encounter by physicians using DAX. That has a ton of impact on various parts of your business. So It delivers operational efficiencies, boosts physician satisfaction, and also improves patient satisfaction and experience. So we'll jump into those in more detail in a minute. But on this slide, we're going to talk about how Dr. Pello mentioned that 79% of physicians state that DAX actually provides a higher quality note than they could provide on their own. And on top of higher quality, it's much more timely. I cannot tell you how often I'm talking to physicians and they say, I've always was behind 80 encounters on my documentation before, which just like listening to breaks my heart because I can't imagine the stress of trying to remember all of that. And we also look at EHR data from a lot of different organizations and use that to help them understand the opportunity for DAX to help them and help identify the providers who would benefit the most. And we see all these physicians who are closing 80% of their notes more than a week after the encounter. So we look at that impact that has. It's, first of all, super stressful, a massive cognitive load on the physician to try to remember everything that happened a week ago or 80 encounters ago. On top of that, it's a liability. It's hard for them to remember that accurately. And then also they're less confident in the quality of their notes, so they're more likely to downcode. On top of that, even if the quality is good, having that delay causes a lot of problems for insurance prior authorization, referrals, getting claims out the door, and in general, your rev cycle. So being able to improve the quality of documentation and also the time in which it's created and closed is a huge way that DAX can improve your financial situation. We'll jump into patient satisfaction. We looked at the stats around patients who report that encounters feel more personable and conversational with DAX and that they feel like the physician is more focused on them and spending less time on their computer. Another way that we can add value for patients is by reducing patient wait times. This is a study from Metro Health where they tracked wait times as they implemented DAX. And prior to implementing DAX, they averaged a 20-minute wait time. During implementation, which is kind of crazy to me because that's when they're adjusting to new workflows and really learning the system, they had already cut that wait time in half. And then in the quarter post DAX implementation, they had cut that down to a 4-minute wait time. So if you think about yourself when you go to the doctors, the last thing you want to do is sit there and wait 20 minutes to be seen. So between feeling like their relationship with their provider and their conversation is better and the physician's focused on them more and having decreased wait times, that's a huge impact to patient satisfaction. So if your organization has risk-based reimbursement that has patient satisfaction or CAP scores or things like that taken into account, that's another way that this can impact your finances. Increased satisfaction also leads to decreased leakage, increased referrals, and patient compliance when you tell them to do something, which is especially valuable when you have risk involved, and patients following the referrals that your providers give them and actually going to the people that they are told to go see. And then also, if you choose to use some of that time savings to increase throughput, then you can increase access and decrease that backlog of patients waiting to be seen by a provider, which Dr. Pello talked about. Is the providers want to see patients when they need to be seen, and patients want to be seen. So that's another thing that's taken into account in a lot of risk-based reimbursement and is huge for patient satisfaction. We looked at that 7 minutes of time savings that providers average experiencing when they use DAX. Different organizations and providers deal with this differently. So some say, that's great, we want to give all that time back to physicians, and that's our number one focus. Others take a percentage of that and reinvest it to increasing throughput and having those physicians see more time per day. And these decisions can be made on either organizational level or within departments or by individual physicians, depending on your priorities. So if you do choose to take some of that time and use it to see additional patients, it's pretty easy to model out the ROI of DAX. This is an example. Like Dr. Pello said, there's a pretty comprehensive ROI calculator. If you would like, you can set up time with your Nuance account exec and they can walk you through it. But effectively, in this top section here on the left, we calculate the amount of time savings that the physician will receive and also the amount of of additional patients that they would see based off of how much of that time savings they want to reinvest. So typically, this is a really low example. This is conservative, where we're assuming that it takes them 6 minutes to close the encounter using DAX. That's way higher than what we typically see, and that they're only reinvesting 15% of that time, which again is small. But we wanted to show a conservative example here just to show that the ROI is still there. So using these assumptions, this provider is seeing an additional 4 patients per week. And then in the box below that, we attribute a dollar amount to that. So that's looking at the actual reimbursement for the E&M code of that additional visit. And then also looking at downstream revenue and what percentage of that is actual revenue versus profit. For in this orthopedic example, that includes bracing, imaging, potential surgeries. So this model would look very different based off of different specialties and your payer mix and even geography. But this is just an example where we can see that even using conservative estimates of how much time is saved and the amount of time that's reinvested to seeing additional patients, there's a huge ROI here. So again, we have this calculator tool available. We can break it down to impact for providers and for facility. We can throw in your numbers to look at your reimbursement and the time that what you actually want to do with this time and how much you want to reinvest. And then we also have the opportunity to factor in other things in that calculator. So if you know that you're having some of those reimbursement issues because documentation isn't done on time, or oh, we're paying for scribes right now and we could potentially replace some of those, or we were paying for scribes and it's so hard to hire scribes and MEs right now that we can't. And so we really need a way to address these issues. Even if you don't choose to use that time to increase throughput, there's a lot of value in giving it back to physicians. On that outcome slide, you saw that physicians love DAX. That Medscape survey that we looked at showed that almost half of physicians are willing to give up some of their income in order to have a better quality of life. And we also looked at the cost of provider turnover. So this is that same slide where we can see the cost without DAX of the average cost of provider attrition to an organization where they have an 8% attrition rate annually. So taking into account that there's a 70% reduction of feelings of burnout and fatigue with DAX, we've had organizations who are willing to make the assumption that we can decrease that attrition rate by 1%. And that gives us, once you calculate it out, per provider per month savings of about $400. There's a lot of different ways that organizations have given a dollar amount to improved satisfaction for providers. This is one of them. There's the AMA calculator that's out there. There's also a lot of research that shows kind of the negative impact of providers being burnt out. And then in competitive markets or rural locations where it's hard to recruit or keep and retain physicians, there's organizations who have said, we know exactly how much we lose when a physician leaves and it takes a while to recruit another one. So they've attributed some of that value to things that could be improved when you give this time savings back to the provider. So those are just a couple examples of how those outcomes can be converted to dollar amounts to kind of help build a business case and explore if and where it makes sense for DAX to be in your organization from a financial standpoint. Again, if you would like to walk through that with more detail, we are more than happy to do that with you, and you can reach out to your Nuance account executive and we can pull up the ROI calculator and walk through that with your data. We're also happy to look at your EHR data on physician usage and identify exactly what departments, what individuals, things like that. There's a lot of opportunity for DAX to help. And back to Dr. Pello.
Brianna, thank you so much. I think what's really cool about all of this is when we kicked off DAX a year and a half ago, we had a hypothesis that there was really a lot of value. And what we've been able to prove, and we have white papers on this, is that there is a lot of value. And so I encourage you, if you're interested in digging in, please reach out and we will dig in with you. We'll look at numbers with you. We'll look at EHR data with you and really show the value that DAX can provide to you. Now, DAX is the beginning of what we think of as an AI journey, a modernization of the documentation of medicine. And we have other tools that we're working with and we're starting to integrate into DAX. One of those tools is virtual assistant capabilities. And right now this lives within our main speech platform called Dragon Medical One. And this allows automation of clinical tasks, of documentation tasks within the EHR with EHRs where we have partnerships. So these EHRs today are Cerner, Epic, Meditech, and Athena. So you can go ahead and you can use the DMO speech platform to do a chart search or to order medications or review findings with your patient beside you. You can pull those up in your EHR just by using your voice, not taking 20 clicks to find the right screen to show results. And so you can just start to imagine as DAX becomes better and better at what it does for documentation, and as we start to bring in these capabilities from our virtual assistant that lives currently in DMO, you'll start to see this kind of smart room of the future, smart clinical exam room of the future coming around, which I think is really exciting. So that's part of it, but we also have more. We have more that we're working towards and that we're investing in today. And one of those things that was spotlighted in the video is our ambient hardware. So when you think about how does ambient work in your home today, it's probably working on an Alexa or a Google Home or a HomePod or one of the ambient devices that are out in the market. And we believe that there is good use of ambient hardware in the clinic room, whether that is something that can interact with the patient when there isn't a caregiver in the room, or something that captures the audio for the patient, for the doctor, outside of the phone that they use today. Now, we believe the phone will be part of the workflow forever because a provider needs to be able to add documentation and their thoughts before they enter the room and after they leave the room. But the ambient hardware really provides a seamless interface between the EHR and the physician and being able to use that hardware. So we've got version 1 is already out in the wild. We're doing testing with it. That's very exciting for us. And we have multiple iterations of this device. So that's one of the visionary areas that we're investing in. And the next one is what we call an interconnected AI ecosystem that DAX lives in the middle of. DAX is an always on, always listening technology that's there while you're talking to your patient. And so you can start to think of other things that it might do. It might be able to provide clinical decision support. It might be able to provide ideas on your differential diagnosis or what might be the right thing to order or care gap filling, all sorts of interesting things that we're working on with our partners to really provide AI technology at your fingertips while you're physicians or while you see your patients. So really exciting stuff. And I think when I think about what makes DAX different from so many of our competitors out there, it's really this vision of what we're building. We're not a virtual scribe platform. We really are an AI platform. And providers that start using DAX today are really training their documentation assistant for their next 20, 30 years of their career. As long as they practice medicine, that documentation assistant is going to get smarter and smarter and deliver more and more value, which I think is extremely exciting. Now, there's other things that Nuance brings to the table that nobody else in the world really brings. And I think it's these three key things. One thing you might not know about our AI technology is it's everywhere. You probably interact with our AI technology and you don't even know it. When you call your airline, you're probably talking to a chatbot that is Nuance. When you go online and you talk with a chatbot, that's probably Nuance. We have technology that is behind so many different companies out there, and you don't even know that, but we have such deep knowledge within healthcare. We're in almost every hospital in the US, whether that's with our PowerScribe, PowerShare, Dragon Medical One, DAX, or one of our tools. We're deeply integrated into healthcare. We really understand the problems of healthcare. And then that last piece is we understand you cannot create technologies that sit outside the EHR. They need to seamlessly interconnect with the workflow of the provider and the flow of data. And Nuance has been able to build these partnerships, these deep partnerships where we can meet with the highest levels of these EHRs, and they're excited. If you go to the big EHR conferences year after year, when they do their demo, that is nuanced technology that they're showing, because they're just as excited to deliver it to you as we are to deliver it to you. And then the last thing I'll point to is our amazing strategic partnerships. We have the backing of Microsoft. They've been partnering on this with us for the last 2 years. They caught the vision that we caught. They had their own kind of competitive solution that they were working towards, and they realized that they didn't have the healthcare expertise that they needed, and they asked to partner with us. And it's been an amazing partnership, and we're really been able to push the envelope of what AI can do in healthcare. Of course, great institutions like the AMA, and then deep partnerships with our EHR partners like Epic, Meditech, Cerner, Athena. So hopefully by this point, you're like, okay, Jared, okay, like I get it. DAX is awesome. So if you're thinking that, well, mission accomplished by Brianna and I, but really what you want to do is think about what are the next steps? What are the answers I need before I'm willing to actually have a conversation with an account executive in Nuance? So please come visit nuance.com/DAX so that you can learn more. Feel free to call the 800 number you see there today. And with that, I'm going to go over to questions and see what has come in.
Thank you, Dr. Pello and Brianna, for a very informative presentation. We've had some questions come in from the audience. However, we would also like to remind you to use the Q&A box to the left of your video window at any time. So the first question I have here is, how is this differentiated from competitors?
I'll take that. And I would say, I'll just go back to the end of that presentation. I think that when you look at our competitors, they don't have the AI expertise that we have. Most are building either virtual assistants, so I can call out, hey, Epic, do XYZ. And even that is really nuanced technology if you're seeing it at UGM. But there are some virtual assistants out in the market, and the rest are directed dictation. So it's just DMO type capability, the ability to dictate in certain parts of the note. And what DAX really does is takes that natural conversation and then summarizes it. And none of our competitors can do that. And what's really cool, and this is just an aside, we were able to acquire one of our competitors late last year. And when they came on board and we did the demo of the AI for that competitor, they said, I thought this was impossible. I didn't think you guys could really do this. And that really drove home to me kind of how far ahead we are from all of our competitors, because they were the most advanced of our competitors at the time. So I really think that what sets us apart is our AI trajectory, and that we're going to reach automation long before our competitors. And then the other two things, I mean, our deep integrations with EHRs are great partnerships. I really think that's the differentiators.
Thanks so much. Our next question is, what is your pro forma payer mix assumption ratio for this presentation?
Yeah, I'm guessing I should take this one. So that's a great question. There's a lot of assumptions that are made in that, as I'm sure if you are thinking about this, So the first one is payer mix. That was an example that we did with a orthopedic group up in New York. So I don't remember exactly what their payer mix was, and I don't even know if they shared exactly what it was with us. They just shared their averages, reimbursements for different kinds of first of all, for their visits, and then also for their downstream revenue. I think in my mind, what's an even bigger assumption, and this is why we really encourage people to have a conversation where we can sit down and go through the calculator and kind of play with it and put in values that are relevant to your organization, is that downstream revenue can be so different. So I'll use family medicine for an example. There's some organizations where they put in the E&M code for that visit, that additional visit, and that's all that they're really comfortable, where they put in occasionally small procedures or small things that happen here and there within those visits. There's other organizations where they'll say the referrals from those family medicine and PCP visits are why we have those facilities in the first place, and they'll attribute some of those referrals to the downstream revenue of those increased visits. Another example would be if you look at ortho, somebody who does hips is going to have a very, very different, and even hips within different age groups will have a very different downstream revenue outlook if they're more likely to do surgery or if they're just doing imaging and then referring to PT. So there's a ton of assumptions in that model that would need to be, which is why we just show it as an example. And I say, if you're really interested in exploring that, please reach out to us and we're happy to have a more in-depth conversation and model it out for you.
Thanks, Brianna. Okay, we have another question from the audience. Has DAX reduced claim denials?
That's a great question. We have had groups interested in studying that. I haven't seen clean data back. We hear anecdotally a lot from providers and from administrators that that's true. I haven't seen a large amount of data on that. I know that there's organizations that are interested in it. But in theory, and from what I hear anecdotally, yes, but I don't have data on that right now that I can share. We do know that physicians are a lot more comfortable with their documentation quality, so they're more likely to code appropriately, where I know that when I was working in the healthcare organization space, there was providers and they were like, it's not worth it. Like, it's not worth the pain that could come from an audit. It's not worth me having to deal with this. So they would consistently undercode just to make their lives a little bit easier and to reduce their risk. So we also hear a lot of anecdotal evidence where there was a physician who will very publicly say that he not upcodes, but more appropriately codes at a higher level over 20% of his visits now because he feels comfortable with the documentation.
Great. We have a little bit of a two-part question next. It says, I believe you mentioned 79% accuracy in documentation quality. Have you found a certain area where AI doesn't document accurately? And the second part of the question is, when calculating the ROI, do you add in the cost of the quality assurance person listening to the conversation and making sure the AI got it correct?
Okay, I will take the first and third part of this question, and then I'll let Jared discuss, are there certain areas where the AI doesn't document accurately? So that 79% statistic is actually that 79% of providers say that DAX produces a higher quality note than they do. So the way that it's not necessarily that it's 79% accuracy. The accuracy itself, the way AI works, and this is why we have that QDS in the loop, is that the more data there is, the more accurate it can be. So for specialties where we have more data, the AI draft is more accurate. And also for physicians where we have more data, it's more accurate. So that does vary. And then when we do calculate the cost or the ROI, the cost of quality, the quality assurance person listening in is covered. That's completely covered in DAX. It's part of our pricing model. So that is taken into account. And then Dr. Pello, I'll let you speak to the areas where the AI doesn't document as accurately and why we have QDS there.
Awesome. Yeah, I think Brianna started to speak to this, that it's all about the amount of data that you have to make the AI smarter. And so what's good to understand is how medicine has overlaps, because that has made our job a whole lot easier. If medicine were completely siloed and a primary care provider only saw certain things and an ENT only talked about certain things, then this job would be harder as far as collecting enough data for the AI to be smart for multiple specialties. But because there's so much overlapping knowledge between specialties, we see as we add new specialties, they adapt faster. The AI adapts faster. And we have millions and millions of these recordings now. I can't remember what our last number was, between 4 and 5 million, I believe, of these actual encounters of doctors and patients talking. And so depending on the specialty, yes, we have some specialties that are further along, but our first specialty was orthopedics. And it took about a year for that AI to go from what I would say was something that our quality documentation specialists would kind of struggle with until it took about a year. And a year later, it actually was making our quality documentation specialists faster. They could do that job faster of checking it because it was becoming so accurate. And now I'll take family medicine, which is a very complicated specialty. And from the first time we created an AI modeling family practice to where it started to make a difference is about 3 months. And so you're seeing even more complex specialties, and you're seeing a decreased amount of time to achieve really good AI automation. And so, yes, there are specialties where we don't have as much data yet, but we're seeing really great kind of trajectory from the AI. So, and then the last point I'll make is you have a quality documentation specialist trained up in your specialty from day one. So what the provider sees is never low quality. So the provider receives something that's high quality from day one. It's kind of magical for the provider. And then we take care of the AI on the back end. And why that's really important to you is this is something that gets smarter and smarter over years. So it's not like if I have a scribe program and somebody goes off to medical school and I'm starting at 0 again because I have to train somebody. Actually, our AI just gets smarter and smarter forever. So that's what's really cool about it.
Our next question is, does DAX accommodate foreign languages?
I'll take that. DAX does allow for mixed languages to be occurring, but the final story has to be in English. So you can have an interpreter in the room, but say you're a Spanish-speaking physician and you're going to speak Spanish to your patients, well, you'll need to summarize that in English for DAX. As long as you summarize it, that works absolutely fine. DAX has captured many of these mixed languages conversations, so the AI is adapted to it and understands to focus on the English. But in the end, the story does need to be in English.
Okay, unfortunately, that's all the time we have for today. I would like to thank Dr. Pello and Brianna once again for today's excellent webinar. I would also like to thank our sponsor, Nuance, for making today's program possible. Finally, I want to thank everyone in our audience for joining us. We hope you'll join us in the future for another healthcare innovation webinar. This concludes today's presentation.